terrorism erodes a sense of security and safety at both the individual and the community level, and has been associated with adverse psychological effects for those directly exposed. At the individual level, several studies have demonstrated an increase in symptoms of depression, anxiety, and post-traumatic stress disorder in individuals exposed to acts of terrorism. For example, following the Oklahoma City bombing, more than one-third reported symptoms of PTSD.
Post-traumatic stress disorder, also called PTSD, is an anxiety disorder following exposure to life-threatening or other extreme event that evoked great horror or helplessness. It is characterized by flashbacks, nightmares, and impaired functioning.
This disorder displays symptoms such as crying uncontrollably, feeling emotionally numb, feeling overwhelmed by what would normally be considered everyday situations, relying increasingly on alcohol or drugs to get through each day, and frequent suicidal thoughts. Many of these symptoms are usually evident 3 months after trauma and may last up to a lifetime.
When I was over Vietnam, I was over there in 70 and 71. Then when I came home, you know, I knew it wasn't the same because before I went over there, I was happy-go-lucky, laughing and everything like that. When I came home, even to this day, I don't smile. I didn't talk about Vietnam, and I thought that I would spare people because, you know, Vietnam was not a nice place. When I came home, I know that I've been, I started drinking more, and also that I couldn't really hold on to a job. I couldn't have a successful relationship with a person. I would maybe be with them for about a year or something like that and break up, and my jobs, I couldn't have anyone like bossing me around. When I did go to restaurants, I had to have my back up against the wall looking, so I'll be able to look at everything. I just keep thinking somebody is after me. And I figured there was something wrong. I had a short temper. I kept yelling for, you know, no good reason. And so I went to the VA, and what they did is they said, well, do you have PTSD? And I said, you know, I don't even know what PTSD is, so I don't know. And they get you familiar with what PTSD really is and how it's going to affect you and why it affects you. And it was pretty nice to know that there's a reason for what I was doing. So I would definitely recommend any veteran go and try to get help. It is very much better knowing the reasons why you're like you are, and also to be able to work things out.
In order to diagnose a patient with PTSD, he or she must have been exposed to a traumatic event or experience involving intense fear, horror, or helplessness. The event must involve a threat of death, serious injury, or physical integrity, and it may affect himself or others around. The patient would show some of the common symptoms that were just mentioned. In addition, the disorder should affect important areas of functioning, for example, work and social life.
Some risk factors for PTSD include being female between the ages of 40 and 60 years old, children present in the home, having psychiatric history, and having severe exposure to some type of disaster or significant traumatic event. One interesting thing is that there might be some differences between various ethnic minorities or perhaps even cultural groups, because there seems to be some difference in the rate of PTSD despite similar rates of traumatic events or life stressors.
2001, the population of the United States was a victim of a terrorist attack that triggered a wave of post-traumatic stress disorder. Within the first week after the 9/11 attacks, a survey was conducted of 560 adults and found that 44% of participants reported substantial stress reactions. In addition, 1 or 2 months after the events, another study reported a 4.3% prevalence of PTSD on the subject, which was associated with the number of hours of television coverage and the number of graphic events shown related to 9/11.
As mentioned before, PTSD not only affects the immediate patient but also those around him or her. Most of the evidence concerning the negative impact of a PTSD veteran as a father is based on studies of Vietnam War veterans. Clinicians have reported that children of PTSD veterans experience learning difficulties, hostility, and guilt feelings, as well as social problems, difficulty coping with stress and regulating emotions, and that they tend to imitate their father's symptoms.
Although it is not conclusive, studies based on parental reports present a similar picture. When compared to a control group, children of war veterans with PTSD were found to have higher levels of behavioral problems, emotional difficulties, and social problems. The father with PTSD and his spouse tend to characterize their children as suffering from depression, anxiety, hyperactivity, and aggressiveness.
Currently, there are over 2.3 million American veterans of the Iraq and Afghanistan wars, and at least 20% of them have PTSD and/or depression.
As a U.S. Army vehicle mechanic, June went into Baghdad in 2003, the start of Operation Iraqi Freedom. She had an incredible attitude. She wanted to win this war. But after a few months of doing checkpoint security and driving in country, a patriotic June Moss went from this to this. She had become a soldier mentally battling the brutal realities of war.
Decapitations. You saw the charred bodies from the explosions and seeing all the debris.
Does that still come back?
It comes back, but only when my stress level is high. So I try to minimize as much stress as possible. But I do notice when I'm stressing out, then I start having dreams about what I saw and the fear and just the all-around experience. It does come back as if to haunt you.
PTSD doesn't go away, does it?
Unfortunately, no, PTSD does not go away. It's not that simple. You're always one incident from spiraling out of control back to where you were at, being depressed.
You know what I remember from our last interview? You talked about anger being a problem.
Sometimes when you have PTSD, you just lash out.
Yeah, I was an angry ball of mess back then.
Is anger still a problem now?
Anger's still an issue.
PTSD is different from most mental health diagnoses in that it is tied to a particular traumatic life experience that typically involves the potential for death or serious injury. Types of PTSD include bombing, mass shooting, plane crash, violent assault such as domestic violence, exposure to community and/or terrorist violence, and sexual abuse or assault.
According to the American Counseling Association, PTSD patients can cope with their disorder by recognizing their feelings and talking to others about their fears. They can also listen to family and friends to encourage them to seek counseling. Another important tip is to recognize normal crisis reactions and take time to do something they enjoy. As Kyra Phillips said in her interview, there is a long path to go through, but at the end the patient becomes a new person able to reintegrate to society and live the life they lived before.